Right? I mean, definitely don't know. Right, so I think with that emotional distance, I think one would have to begin to the extent that it would be clinically significant, and on the shelf exam, it's likely to be clinically significant. Beginning with the schizoid personality. Right? He prefers to avoid intimate relationships, nothing intimate about his partner, right? Do you think that if he didn't get that computer message, that he would have followed the short? To that, zero chance. I haven't done this, I have no problem doing it, I never had thought to do it, but I wonder if the number of minutes we actually calculate Mr. Anderson being on that screen during the matrix at night versus day would be significant. Right, because it really doesn't seem like he interacts much at all during the day, and if anything, he tends to be up all night, which could be for various reasons. But this is not someone who's got a double major who's in the middle of block exam. Right? He's up all night largely because of his need to avoid social contact, his preference to be alone.
Even when he meets the team, he doesn't really seem to connect with very many of them.
No, I just think that we wouldn't expect him to if that was his personality style or not. That said, how might someone like this come up or appear in an exam? Because they are very, very unlikely to self-report. Because they're very content with their life of solitude. If when they work, and this is not something that is consistent in the movie, and in fact, this is inconsistent. I would have much preferred, not that any of the producers asked me, to have Mr. Anderson employed at a night job. Right? That would be much more consistent. There are films that actually have individuals with this condition taking jobs that a lot of people prefer not to take, right? Working during the night. Well, that would have been an easier fit here. It's not perfect, right? Matrix only gets a 9.9 out of 10. That said, he is not likely to present with your exam with a chief complaint of anxiety or depression. Matter of fact, not that it's a giveaway, but a red flag that the single best answer is schizoid personality disorder would rather be along the lines of a third party referring him for evaluation, like the Board of Health, due to his disheveled apartment and neighbors complaining. Right? So something to consider here. There might be even more because we have to have a discussion as to whether we're not going to have this discussion, but whether or not he actually saw that computer message, whether it was real. Or did he impart some kind of personal meaning to something that was quite neutral, right? That would be an idea of reference, and that would hallmark his behavior as being odd and eccentric. So in addition to his being socially distant, we have additional criteria that perhaps meets the diagnosis of his schizotypal personality disorder, right?
Mm-hmm.
Now, both schizoid and schizotypal do confer risk for developing a future psychotic disorder like schizophrenia. Schizotypal actually imparts greater risk, but schizoid is not without risk itself. Right, so something to consider here as we begin to case formulate what's going on. The beginning of this movie, chronologically accurate, may actually depict the etiology of a psychotic brain. Right. Anything else with regard to Mr. Anderson? Okay, so let's talk about Neo. So he finds Morpheus. Morpheus finds him. And we get to see more behavior. Obviously, he becomes the focal point of our film, the lead character, and therefore the focal point of our analysis. What else did you say? At this point, is completely quote unquote normal. He has a relationship, he had kids, family, there's a picket fence, and even a dog.
Reality testing is question.
Reality testing is significantly questionable. Right? No doubt. So there does appear to be some breach in reality testing, which means that he probably evolves beyond quote unquote just a personality disorder to now a psychotic disorder. And if you're considering psychosis, I think a nice place to start in terms of your case formulation would be schizophrenia. So at this point, demonstrate your knowledge of the DSM, demonstrate your knowledge of the shelf exam, give me the 5 inclusion criteria for schizophrenia. One, Two. Delusions are three. Four? Perfect, right? You need two? Over a 6 month period. Now, I don't know the time frame here. It's not appear to be 6 months, but then again, I'm not completely sure about that, but in any case, you are required to reach a threshold of two. Does Neo reach that threshold? Why or why not? I see some nods. Give me the scene or give me what you saw that allows you to say that he's reached two, at least to this criteria.
He's been having those visual hallucinations, especially with the cat.
One. You definitely have perceptual differences.
These delusions.
Yeah, you see, he comes around to believe he's the chosen one. Probably the delusion. But we all know that Donnie Darko is the true chosen one. That's a movie. That's another thing. He needs two, which then is, at least at this point, the original diagnosis ruling him in for a condition, schizophrenia. Next step is to acknowledge, to appreciate that this condition is actually a diagnosis of exclusion. So what 5 conditions must the investigator now delve into to rule out? Substance use psychosis, that's definitely one. Any others? Primary mood disorder, good. 3 more. Two is an underlying medical condition, good, 2 more. Good. It's all back there. Then the last one is the autism spectrum disorder. Okay, starting out with autism spectrum. Neo, therefore the Matrix, is a fictional account of autism spectrum disorder in that our main character demonstrates aspects of A and C. A true, B false, C doesn't matter. Okay, everybody knows it's C. All right, I see that in your eyes. Why? I got the feeling in the room you were about to just blurt out A, and all of a sudden everybody just stopped. It's because when the American Psychiatric Association provides this definition, these rule outs in that schizophrenia, that diagnosis of exclusion, they identify that people with ASD struggle with areas of communication, both verbally and non-verbally, right? So bizarre behavior, as well as disorganized speech, thought process, may overlap. So there is inherent misdiagnosis. So with a pre-established condition of ASD, an individual presents to you establishing a new physician and demonstrates clinically significant thought process, as well as disorganized or catatonic behavior. You can't diagnose them with schizophrenia just because of your observation and your having been invited this discussion. It's ASD because of the pre-existing condition. Now, individuals with ASD can in fact develop schizophrenia. And evidence of that would be, even with a pre-established condition, if the patient also demonstrates hallucinations and delusions, they're not part of the overall. You can diagnose someone even with ASD, with nuance that's schizophrenia. You just told me that the 2 criteria that Neo meets, in fact, are those positive symptoms of hallucinations and delusions. So it's choice C. It doesn't matter. It doesn't matter. Any questions on that? That goes up on shelves, shelf exams. So just pay close attention. ASD is a rule out, but it's not a definitive. It may not matter. All right. Is there a depressive component? Is there a mood component to this? Because if the answer is no, primary mood disorder with psychotic features, as well as schizoaffective disorder, can be removed from our differential. And unfortunately, you really only have to go by what you see when he is Mr. Anderson. There's no prequel to this. So the information we have is it. I think for didactic sake, we'll say no. Again, I'm reading the room as the hesitancy, not overwhelming evidence that Mr. Anderson is actually afflicted with a primary mood disorder, so even if you're conservative and want to just keep the new differential, it's going to go very low. Right? Is our main character afflicted with an underlying medical condition that would explain his new onset psychosis? Is there something in this script that allows you to say, yeah, the Matrix is actually a depiction of psychotic disorder due to an underlying medical condition? So I'm giving a lot of notes. Now, gets a little tricky here. Even when there's no overt evidence, if you brought up the script, went to the search tool, and searched medical condition, nothing comes up. Is that enough for you to be reassured that his psychosis isn't due to an underlying medical condition? And this is a practical question for outpatient psychiatry, for psychiatry in general. And the answer is, it kind of sort of depends. Meaning that if the individual doesn't provide any significant risk factors, then the clinician usually moves forward with the next step in the diagnosis or the case formulation. On a shelf exam, what are the two most important risk factors? And asking the same question a little bit of a different way, what are those two most important protective factors? Thoughts?
Support system.
Support system, it's important, but I wouldn't rank them one or two. Which one is? So one of these. He's relatively young, so that's a protective factor. If this same character was 74 and presenting like this, the fact that there is no overt evidence of a medical condition in the script doesn't reassure me nearly as much. Right? Loss of protective factor, 74 years of age, the addition of a risk factor. Age is a risk factor. What's the other biggie? Especially on shelf exams. Yeah. Yep. Female sex is protective. Male sex is risk. He's male. That's concerning now because he's at intermediate risk. He's young, he's male. And he really has a similar risk than an older female. Right? So intermediate, if you were to say, conservatively, he's a differential, even though there's no prevention, it's very similar to a patient coming to you and saying, go test medical history. Right? 74-year-old male, you're going to shrug and say, okay, well, we're going to probably do a battery of tests anyway. Right? Young male, conservatively, you're going to do the same thing. Right? Older female, conservatively, you can do the same thing. It really depends on your way you practice medicine. If Neil were cast as a female, we can simply say, no problem here. Now, does that mean that something bad can't manifest later? Sure. But on a shelf exam, you're safe. Right? Something to consider. Right? Artificial environment, but then again, solar films. So in this case, it's intermediate. Let's keep this conservatively in the differential, but again, we're going to drop this low. Right? That leaves us with one. Is the Matrix a fictional case depiction of a substance-induced psychotic disorder?
So I was wondering about that because they do inject him with something before he literally wakes up and sees the real world, right? We don't really know what's in that injection.
Okay, it's a concern.
He also takes pills.
He also
The red pill.
he takes the red pill, right? Did he answer? So what Disney film is the Matrix of the What's Alex? That was it. One long acid trip. And therefore, so is Neo. Now remember, he's in the Matrix the whole time. Right? When he takes the red pill, he unplugs. Right, literally. So the blue pill would be the metaphor for LSD-induced psychotic disorder. And again, this is just coincidental. We have to actually call the writer director to see if there's anything behind this. But when exposed to UV light, guess what color LSD fluoresces at? Yeah, absolutely. Yep. So this is an LSD trip, and until we get our patient sober, at least 1 month, in general practice, 6 months, reevaluate If symptoms continue, then we're reassured this is likely a primary psychotic disorder without schizophrenia. But of course, if the symptoms resolve within the 1 to 6 month time frame, Matrix will in fact have a case study of a substance abuse hallucinogen induced psychotic disorder. Now, hallucinogens are one of several substances that can induce psychosis. Again, we could remake the Matrix and substitute the LSD, that blue pill, for something else. What are those substances that can induce psychosis? And before you answer, as you're thinking about the list, I want to ask if anybody's ever seen Paranormal Activity, which I didn't assign. No, it's really depressing. Really? All right, somebody look it up. I want to know the cast. So simple, quick search as we're coming up with our list of substances that can induce psychosis. By the way, when he goes to that rave, that group tells him they're using mescaline, peyote. Right, so there's already a little bit of a foreshadowing that this is all hallucinogen induced. Unlike LSD, peyote or mescaline is a subgroup of psychedelics that are your bioactive amines. Right? Others include DMT. Right, that's ayahuasca. You got a guess? Here you got.
Katie Featherston,
One more. Oh, actually, probably two more, but again.
Micah Sloat.
Oh, actually, there was one more. Okay. Right. So the lead male character. So for all intents and purposes, not going to give anything away. I can't believe you guys have not watched this movie. Anybody here like demonic possession films? Right. I never used this movie. Check this one. Also, all 6 of them. I have the count correct. All of them are really good. The first one's my favorite. The second one is very, very close. All that said, I don't want to go off on the tangent too much. How does our lead male character spell his name? What for his first name?
Oh, in the Paranormal Micah.
Please spell
MICAH.
it. H, right. This movie, again, not giving anything away, is also about psychosis. And the lead male character's name, Micah, gives you an acronym for all the drugs that can induce psychosis. So that includes methamphetamine and other things. There does not, I mean, the person definitely been at this rave. We don't know if it was. Anybody? The class of drug that can induce psychosis. Inhalants, good. See? That's under M for methamphetamine and other stimulants. Cannabis, good. A, alcohol and hallucinogens. Now, hallucinogen itself as a class has 3 subclasses, one of which you already mentioned. The second, look at the 2. Well, ayahuasca and peyote would be examples of psychedelics, specifically amines, bioactive amines, a subclass. Number 2 would be the dissociatives. Can somebody give me an example of a dissociative? PCP. And another one would be ketamine. Salvia, probably a third. And dextromethorphan. By the way, what's Disney DXM induced psychosis? What demographic tends to abuse dextromethorphan? Children, yeah. Very easily accessible. Peter Pan is actually streaming for PCP. So it's just way too low hanging fruit, not, to say PCP. For DXM, so the Disney film will cast a child. And what you need to know about DXM on board exams is that at lower doses, it's a serotonin and pathogen. So belongingness, closeness, so it would not only be a child cast in this Disney film, but in addition, someone who's struggling with belongingness. At higher doses, however, and there's 4 discrete levels. As you get to the higher doses, glutamate is the predominant neurotransmitter, and you actually have psychosis where people actually build universes in their own minds. They'll actually talk about how retreating into their own universe in their mind, right? Which actually happens in this movie. What movie am I talking about? Yeah. Inside Out. Yeah. It's kind of cool about this movie. Anybody here see Inside Out? Right? Many people who have seen the movie and who discuss this film will talk about the plot, which is what? I'm trying to bait you to say something and turn the tables on you. So a non-psychiatrist sees this film and is asked, hey, by the way, I want to see this. What is this movie about? In a sentence or two, what's your like ultra brief synopsis on Inside Out?
A team experiencing depression.
Yeah, that's too analytic. I mean, you're thinking like a medical student.
Moves to a new city and tries to reconcile being there.
That's definitely it moves to a new city. Yeah. Who gets lost?
So,
Sadness and joy. Yeah, most people watch this film will tell you it's a movie where the feelings that are personified, specifically joy and sadness, get lost. And while that is true, what people miss are the 3 that actually remain. What 3 actually remain? Right, which happen to be all the DSM under DXM intoxication. Right, so it's just ironic that minus joy and sadness, the real raw feelings that are left just so happen to be the described intoxication state of DXM. I have much more in this movie. I don't want to hint too much. Let's get back to the Matrix, right? As a potential hallucinogen-induced psychotic disorder. Now, that said, there is one more subclass in addition to the psychedelics and dissociatives. They're called deliriums. And these are drugs, including medications, that have anticholinergic side effects. And so that's a 3rd class. Neo presents to you in clinical practice with all the information contained in this film. If we are at a point now where we're considering schizophrenia, rule out the substance-induced schizophrenia, let's say that he is without LSD or any drugs for 6 months, and he's presenting to you with the same symptoms. Okay. So at this point, what are some additional things you've observed that you think will count towards your case formulation?
You have to argue that we recently violated.
Yeah, I mean, you definitely have symptom progression, right? If you didn't have disorganized behavior in the beginning, not sure what you'd call what's going on towards the end of this movie.
I feel like his affect was flat. Like so much happened around him and he just.
Some negative symptoms as well. Yeah, he is actually good. And again, it's hard to tease that out of his pretty more of a baseline. Someone who's socially distant and I think flat in affect is also part of the definition of recovery personality. So that might be pre-existing, and again, we have to consider that it's also a negative symptom. What's Neo's reaction when someone wearing a black suit and white shirt approaches him? Right? That's that fair? Yeah. What's his reaction when someone who is not dressed in a black suit and white shirt approach him, but he's otherwise in the matrix? What is he being taught and what does he do? And he knows to hightail out of there when he sees Agent Smith, right? But same exact time, same exact place, he sees someone that he notices who does not look like Agent Smith and is not wearing a black suit. What's his reaction then?
It's the red woman. Is that what-
Yeah.
Yeah, so just like focuses on.
Her, yeah, and then, and what does he do at every point in this movie after he sees the red woman and he actually completes that program? He runs too. Why?
Do you think everyone? Or he's taught that, not to trust people.
Well, I like the way you initially phrased it. You think that, right? What do you call it? That's what reality is. Right now. And again, if you're touching on this, I want you know, I want you to put yourself 3 o'clock in the morning on the hall as a resident of mine. Presenting the same information and me asking you what you think's going on. I doubt you're gonna say, Toby, we're entering the matrix, right? You're not gonna be my resident for long. So the answer is, it's not reality based. So would it be fair to call it a delusion? On your board exam, it's a specific type of delusion. It's definitely persecutory. It is. It's even a subtype of persecutory delusion. Bring it back to that. Thank you for bringing it up. Delusional belief that individuals can actually shape, yes, it's referred to as a shapeshifter syndrome, not board exams. That's more of a layperson stuff. Board exam is the Fergoli syndrome or the Fergoli delusion. Comes up in the same. I thought GOL, Fergoli. Named after an Italian performer who gets renowned to change so quickly off stage that. Oscars. Fergoli. So the matrix is shaping up as a substance, specifically hallucinogen induced psychotic disorder that demonstrates or manifests the Fergoli delusion. Let's talk a little bit about delusions. And let's kind of reframe the let's say that he had delusions, which again, I think everybody's cool with here. But let's say that he decided to just rewrite the script and just think of that. No hallucinations, no disorganized behavior, no disorganized speech or thought process, absence of negative symptoms. What's your working diagnosis now? How does that change with the problem? Yeah, delusion disorder. Now, delusion disorder comes in several types, subtypes, right? What are the 5 themes of delusion, and therefore, what are the 5 different subtypes of delusion disorder? Yeah, this is very definitely one of them. Grandiose, good. That's a type of delusion, but not a subtype or theme of delusion. So not good. It's not always the one that everybody always forgets. You better time. And then great. The acronym is JPEG. Right. So we're missing jealous. Around that. Everybody got all 5 of them? Now, if an individual is suffering or demonstrating a delusion, not really contained in one of these artificial categories that we've created, we call it unspecified. Delusional disorder, unspecified, is not likely to come up on a shelf exam as an answer. It is likely to come up as a vignette because the unspecified types of delusional disorder go by proper names. They're usually named after the individual who first discovered or described it, Fergoli being one example. What are some other examples?
Not what's happening. It's your dad. You're not.
That's the 6th sense, right? Which is what? It is euphemistically referred to as the walking dead syndrome. You're not going to see that any board exam. Good, it's hard, good. And there's one more very common one. Oh, not common. Commonly presenting in exams.
You think I would be possible?
Right, the body snatcher syndrome. Again, that's not the official term. What is? Capgras. Spelled CAPGRAS. imposter syndrome. Everybody is imposter, the individual is impossible. Doesn't have to really say that. All these are delusional disorder. All of these are examples of delusional disorder in specifying type, which are much more likely to see them with their proper names. Bergoli, Petard, and Cockroach. Other observations. The matrix. Okay.
I felt like Trinity was so strange being like, in the public thing, where she said, like, you know, one day with him, like, two doors.
Let's go with that. You think?
Like before, we were talking about how he might show some themes of schizoid. This is Neo, but schizoid typically like withdrawn, no intimate relationships. But in the end, I mean, it's up to interpretation. But it seems like her love wakes him up and like brings him back to life, right? So, which is like the opposite of what schizoid would be. Schizoid would be like love. There is like maybe no love. Maybe you can't form love. So I thought that was like the reverse.
I mean, from a non-psychiatric perspective, what they did was merge very, very common things in Disney film. Beauty and the Beast basically made Sleeping Beauty. Right? Where after a large period of isolation, the Beast / Mr. Anderson meets his princess, and through a Sleeping Beauty motif is awoken. More in this relationship. There might be more here. And you can have lots of this shelters and, but I mean, defense of Trinity. She has actually met him and knows him for a long time. Well, I don't know, stalking, but I mean, she's been paying attention to what he's been doing. They've all been kind of spying on him. I don't know if spying is a real word, but basically coaching him to come out of his shell so he can actually fulfill his destiny. And she's right there in Morpheus doing this. So it isn't like she really does meet him for the first time. And again, this is way ahead of its time. That's fairly common practice in 2024. Where a lot of relationships are online, and I think this is a culturally sanctioned behavior now. It may not have been in 1999 or when this premiered, but boy, if you're meeting someone face to face in a real space, you might actually be the minority. So I'm not so sure Trinity's really off base and really a little ahead of her time. What else with Trinity?
I feel like the fact that she was told by the Oracle that she was going to fall in love with the one, and then Morpheus is like, oh, he's the one, almost kind of played into her falling in love with him.
Yeah, well, yeah, there's something going on with that dynamic, right? And again, for purposes of these discussions, and we'll say it once, but then we'll move past it for the remainder of our clerkship, because a lot of the films that we choose to discuss have that dynamic. And that means they have that dynamic that really does explain a shared psychotic disorder. So almost every movie we talk about can actually be shared psychotic disorder. So we'll say it once and then we'll kind of leave it and challenge ourselves to avoid saying it starting next Friday. But Morpheus is very influential here. I mean, they are literally followers of him. And he's got this delusional belief that certainly is contagious. Yeah, well, yeah, yeah. And so again, I think Trinity might actually be part of that dynamic where she comes to believe and adopt Morpheus's delusion. One thing I did want to mention too, I looked it up. Trinity is actually the street slang for a street drug combination. Now, one is muscle relaxer, but the other two drugs are benzodiazepine and heroin. And it's interesting because one of the major motifs in this movie happens to be the reverse Sleeping Beauty, where it's the princess that gives us an awakening to the chosen one. Snow White's the same, right? I mean, very similar endings to both Snow White and Sleeping Beauty. With all irony, an analysis of Snow White is really an analysis of benzodiazepine use disorder. And Sleeping Beauty is about heroin and overdose. So those two, which are contained in this film for that motif, for that final kiss, happen to be two of the three parts of Trinity, the street drug that contains heroin, benzodiazepine, along with the muscle relaxant. So just to throw that out there. And since we mentioned it, and we'll kind of end off on an educational note, we talked about heroin. By the way, Neo is also short for heroin on the streets. I don't think this means about heroin. This is so over the top and acid, but so I just think it's just a random finding. That said, what would heroin intoxication look like? Good.
I'd love to do.
All that said, what if the individual presents similarly, but with dilated pupils? Now what is your single best answer? It's probably still gonna be opioids. Right, if everything's kept the same, but there's dilated pupils, why is the single best answer still opioid overdose or opioid intoxication? Because there are specific opioids that actually dilate instead of constrict the pupils. So don't let the pupillary fountain constrict. What is a common medication that does this? Okay, then.
I forget.
We'll look it up. Okay. That's right. No. Now you make me blank on it now. It's largely due to the medication side effect being anticholinergic. The anticholinergic side effect overrides the opioid effect. I'm not picking on the date. And I'm playing this. Opioid or heroin withdrawal. Who's it like?
Protection.
It's like the flu. The flu on any site shelf is opioid withdrawal. If you must, the acronym is TGI Fridays. So from the list of symptoms, and this is more of a clinical role, you do have to have 3 criteria. So the T in TGY is 3. On the exam, I'm not so sure how often they require you to, especially for drug withdrawal, to reach a particular threshold. GI is nausea, vomiting, diarrhea. Nausea, vomiting, and diarrhea are 2 separate criteria. Fridays, fever, rhinorrhea, insomnia, dysphoria, arthralgia, yawning, and sympathetic, including piloerection, diaphoresis, drumming. Maturity. And I guess on that note, and worth, we will end. So we'll post next week's film. I'm leaning heavily towards the killing of the sacred deer. But I'll post it on Twitter, hopefully by the end of today. Final questions or thoughts? All right, thank you.
Thank you.